Well, hello, and thank you for joining us. We're here to talk about chronic kidney disease, a disease that affects 37 million adults in the US, and how you can take charge of your health to slow and manage kidney disease and related complications. I'm Dr. Griffin Rogers, Director of the National Institute of Diabetes, Digestive, and Kidney Diseases, or NIDDK, at the National Institutes of Health. I'm joined today by Dr. Jonnie Hamilton, a medical manager for Ascension's Community Health and the first vice president of Chi Eta Phi Sorority Incorporated. NIDDK is partnering with Chi Eta Phi Nursing Sorority for the 10th consecutive year to hold Kidney Sunday events to screen for high blood pressure throughout the month of March. Dr. Hamilton has been a nurse for 48 years and a nurse practitioner for 41 of those years. She has extensive experience in leadership, assessment, diagnosis, and treatment of children, adolescents, and adults. Dr. Hamilton is also a program and project director for Chi Eta Phi and manages the Kidney Sunday program. Throughout our discussion, we will be answering some commonly asked questions about kidney disease. If we don't answer your question during the live video, please check our social media feed at NIDDK.gov, where we will continue to try to answer your questions. Thank you for joining me today, Dr. Hamilton.
And thank you for having me, Dr. Rogers.
Well, chronic kidney disease, or CKD, is a serious condition. Your expertise involves working with many different kinds of patients, including those who have kidney disease. How do you begin that conversation with your newly diagnosed patients, or explain what kidney disease is?
Yes, first I'd like to tell my patients a little bit about chronic kidney disease and how it affects their bodies and them. It means that their kidneys are not functioning correctly. It's not being able to clear out the waste and the water that would help them keep them healthy. Disease is called chronic because it happens over a long period of time. It's not something that happens quickly. The damage can cause waste to build up in your body and can cause other health problems as well. I also like to tell the patients that kidneys' main function is to filter out the waste and water and to produce urine to keep your bodies working properly. The kidneys balance the salts and minerals in your body, and also it manages other things like making hormones to control blood pressure, make red blood cells, and keeps your bones strong. I try to get across to patients that kidney disease often gets worse over time, and it may lead to kidney failure. If your kidneys fail, you will probably have to have dialysis or a kidney transplant in order to stay healthy. The sooner someone knows that they have any kind of kidney problem, the sooner they can make changes to protect your kidneys from failing.
Well, that's a great explanation, and we certainly know that certain people have a higher risk for developing kidney disease. What do you tell your patients about their risk?
First of all, I tell them that one great factor is age. Anyone 65 and older are at greater risk. Diabetes is the next big cause. 1 in 3 people who have diabetes also will get chronic kidney disease. If you have diabetes, having too much glucose in your blood, or sugar, it causes your kidneys not to filter properly. High blood pressure, that's the second greatest cause of kidney failure. Nearly 1 in 5 adults with high blood pressure will eventually have chronic kidney disease. Having high blood pressure can damage the blood vessels in your kidneys and cause them to not work properly, and as well as not being able to remove the waste and extra fluid when it's necessary. Also, heart disease and having a family history of kidney failure are also some problems that can be caused. And as you know, the higher rates of diabetes and blood pressure in African American, Hispanic, and American Indians, this group also tends to have a greater risk for chronic kidney disease.
Yes, yes. And to add to that, the longer a person has diabetes or high blood pressure or heart disease, the more likely that person will develop kidney disease, which is why it's so important to understand your risk. For those of you watching us on Facebook, NIDDK offers free online information about chronic kidney disease, as well as information about risk factors and current treatments. You can find this information on our website, niddk.nih.gov. For people who are at higher risk watching right now, what are some early steps you would suggest that they can do to protect their kidney health?
Oh, first of all, to prevent kidney disease by living a healthy life, sleep, getting enough sleep, eating healthy, and keep moving. Get those steps in, those 10,000 steps a day. Second, I'd say get tested and check on your kidneys frequently. Early detection is the best way to know if you have any symptoms. And it's a simple test, a blood and urine test, and it only takes a few minutes to tell you how your kidneys are working and to catch kidney disease early. If you have diabetes, high blood pressure, heart disease, or a family history of kidney disease, it is especially important to have to check on your kidneys.
Absolutely. I agree. I couldn't agree more. Prevention and monitoring your health, especially if you're at higher risk, can make a difference in staying healthy for longer. What do you think is the most important thing that for people who are considering getting tested for kidney disease to know?
Okay, I would just tell them the testing for kidney disease is easy and involves just a simple blood and urine test, something that they could probably just do in their annual physical exam. The blood test is used to estimate the GFR. GFR stands for glomerular filtration rate, and it just checks to see how well your kidneys are filtering your blood. The urine test is used to check the albumin. Albumin is a protein that can pass into the urine and off when the kidneys are damaged. So that's what the urine test is for. If you have diabetes, get tested every year. If you have high blood pressure or heart disease or a family history, then you need to just talk to your doctor about how often you should be tested. As we said earlier, and the sooner you know that you have kidney disease, the sooner you can get treatment and help protect your kidneys. Also, don't be afraid to ask your doctor to explain the test results or bring a list of questions with you to your doctor's appointments. For the more you know, the more empowered you will feel and the better you can protect your health.
That's a very important points that you've made, especially to not be afraid to ask your doctor for the test results and to write down questions in advance. That way you can make sure that you have them top of mind and you can say, before I go, let me just ask you a few questions that I thought about earlier. So this is really important information that people can act upon now. I also want to mention in the midst of the current pandemic that people who have any stage of chronic kidney disease are at increased risk for developing severe illness from COVID-19. They should take precautions to avoid getting COVID-19, including things that you've heard a lot about, on the news and on TV and radio, including limiting interactions with other people as much as possible, practicing social and physical distancing. That means staying at least 6 feet from other people who are not a part of your household, both indoors and outdoor spaces. Wear a mask to protect yourself and others. Wash your hands often. Limit contact with commonly touched surfaces or shared items. And once you're able to, and I can't stress this enough, and your doctor says it's okay, get vaccinated. If you're just joining us, I'm Dr. Griffin Rogers, director of one of NIH's institutes, the National Institute of Diabetes, Digestive, and Kidney Diseases, and I'm here with Dr. Hamilton, who is a medical manager for Ascension Community Health and the first vice president of Chi Eta Phi Sorority Incorporated. Questions that we frequently receive, and I see we have two here. It's so important. I know you've covered this a little bit, but let's just ask, have you address it again. What should I do if I have high blood pressure? One listener asked.
Okay, if you have high blood pressure, the most important thing to do is to make sure that you take your medication properly. Medication needs to be taken as directed. And I always tell patients to make sure that if you have medication that you have to take twice a day, you need to take it that twice a day, every day at the same time, just so that your body is getting the blood level so that medication can act properly. The other thing you need to do if you have high blood pressure is to make sure that you know what your blood pressure reading is and to take your blood pressure at home. I think there's going to be a little video that will show you how to properly take your blood pressure. That'll be on the information or the references at the end of the program. That's going to be very important as to how you can take your blood pressure at home so that you can monitor your blood pressure so that you can see how it is actually how it actually is daily and not just when you go to the doctor to get your blood pressure taken. And the other thing about blood pressure is to make sure that you eat healthy and you limit the salt in your diet. That's really very important. So, and the other thing is to make sure that you actually do exercise. Is very good for making sure that your blood pressure stays stable. So all of those things are going to make you sure that your blood pressure is kept at an even rate in a normal that it's at a normal monitoring rate. So that's one of the good things to do about checking your blood pressure.
Thanks so much. Here's another question that we have, and I know you touched upon this a little bit earlier, but again, it's important information for those who maybe have just joined us. How do I get tested for kidney disease, and what does that entail?
Okay, the test is very simple. It's a blood test and a urine test. The blood test is just drawn and it tests how your kidneys are functioning. And the urine test checks if you're excreting any albumin, which is a protein in your urine. So those are just two simple tests, a blood draw and a urine test.
Okay, is that something that your doctor or your healthcare provider is likely to do on a routine basis, or how do you be a little bit more proactive to make sure that it's done? Or how do you instruct your patients?
I always say that on your annual physical exam, if you don't have a blood test done, a blood draw done, or a urine test done, you should ask for it because it's something that you need to have checked on a regular basis. Because there are other things besides kidney disease that can be checked when you have your blood drawn and a urine test. So it's very important, especially if you have a history of diabetes in your family, hypertension in your family. It's always a good thing to ask about having the test done.
Absolutely. Good. I couldn't agree more. Here's one other question. If you have a lot going on at home, how can you make time for yourself?
Okay, I always say for me, for instance, I work every day and having to do things. So actually, if you kind of make a schedule for yourself, you need to take 15 to 20 minutes. That's your time, called me time. So you
Mm,
take your me time and you do some things like maybe reading or relaxing or meditating or some exercise, a little dancing or whatever you need to do for your me time. So I think that's going to be important for you to make sure that you schedule that into your day. It may be at the beginning of your day or the end of your day, whatever works for you. I'm an early riser, so my me time is usually in the morning about 5 o'clock, from 5 to 5:30. That's my me time, so I can do my exercises at that point. I can make sure that I've done all the things that I need to do. Then I can get ready to start my day.
that sounds great. Well, let's shift a little bit and talk about managing kidney disease. What do you think are the best ways that someone can work with their doctors to manage their kidney disease?
Okay, I think it's really important to make sure that you're engaged with your providers. You may have your primary care provider who is taking care of you on a daily basis, but you may need other people in your to be able to help. A nephrologist, which is a kidney specialist, may be one of the persons that you may want to have in your team. A registered dietitian, a diabetes educator, and maybe even a trained mental health therapist. Because sometimes, when you have a chronic disease, there may be a little bit of stress or a little bit of depression that may go along with that. So you may want to make sure that you're doing that. One of the other things is to make sure you stay engaged with your providers, keeping your appointments, even if you're feeling fine and if you have no symptoms or you think you're okay. You make sure that you always keep your appointments. Goals for your blood pressure and your blood sugar, there should be some goals. If your blood sugar is supposed to be, say, at 100, you want to make sure that it stays that way. You want to make sure that you take steps to increase your physical activity. There are times when you may say you don't have time, you can't walk, or there's no time to go to the gym. There's some things that you can do at home. There's some chair exercises that you can do. All of those things are very good things to do. You also want to look at your eating habits and how are you eating. Look at what your meals are. Check your the ingredients that you're using. Check if you're using frozen, canned, or whatever foods that you're using, and look at the labels. Read the content so you're not getting more sugar and more protein in your diet than you need. So all of those things are very important. Also, I say if you can't get your medications, foods, or transportation, you need to talk to your care team. Maybe they can help you by providing some information for you that will help you make sure that you can get these things done.
Absolutely. Those are really great points. And to your last point, there are clearly resources that exist out in the community just for those to help you overcome those challenges like transportation and food and medicine and therefore. So I think those are all great points. Open communication is definitely important. And a tool that may help with that communication is the use of telehealth, which can be considered during times like the pandemic or in the event of severe weather or long distance travel or other things that are really not convenient. Telehealth is using your smartphone, computers, or tablets to meet with your doctor or healthcare provider when you can't get to the office. You can check and send your doctor information like your blood sugar level that you just mentioned, your blood pressure readings, or your weight electronically. So check with your doctor to see what your telehealth options are. Options may include general wellness visits, nutrition counseling, mental health counseling, and many more. Things that you have emphasized here, Dr. Hamilton. Telehealth is not appropriate for every type of appointment, but meeting virtually can improve access to, for example, specialists. It can allow caregivers in different locations to join those discussions and maybe remember some of those questions that you forget to answer yourself. And it can allow you to get an appointment with your doctor even more quickly. Earlier, we talked about the highest risk factor for kidney disease and some of the things a person can do to start protecting their kidneys. What healthy lifestyle tips do you give your patients to help them manage chronic kidney disease and improve overall health?
There's some things you can do besides controlling your blood pressure. Monitoring your blood pressure levels, if you have diabetes, is one of the most important things you can do. You need to keep your blood sugar at a range for a target goal that you and your provider have set. You need to use the results to guide your decisions about the foods you eat, the physical activity, the medications. And your health provider can often show you how to check your blood glucose levels and the symptoms to watch for. That's something that has to be done. It's actually a collegial relationship that you have with your provider. Also, taking medications as prescribed, and you want to stay away from non-steroidal anti-inflammatory drugs like ibuprofen and naproxen. And your pharmacist and doctor know about the medications you need to take so they can tell if there are any interactions that may occur. And some of those NSAIDs are under different brand names. So always ask your pharmacist, is this a medication going to be fine for me? Is this something that's going to work with what I have? Is it going to contraindicate some of the other medications that I'm taking?
Mhm.
Let the doctor know if you're experiencing any kind of side effects, any symptoms that are not usual for you. Make sure that you talk to the doctor about it. The other thing is aim for a healthy weight. If you're overweight or obese, you need to set a plan to lose some weight with exercise and healthy eating. That's where a registered dietitian may come in, and you may be able to talk to them. They can make a plan for you to have a better food plan, something that's going to work not only with your diet and your circumstances, but also what you can afford to buy at a store or whether that those things are accessible to you in the community where you live. That's
Mhm.
what you call about aiming for your healthy weight. You also need to develop a healthy plan, your healthy meal plan. You still set up your meals that contain kidney healthy foods and beverages so that and things that you enjoy. Fresh foods and fresh vegetables are better, but sometimes if they're not available, frozen is much better than canned. You need to eat the right amount and the right types of proteins. So when your body uses protein, it produces waste. So your kidneys, that's one of the things that your kidneys do. It removes the waste products from your body. So you need to eating more protein may make your kidneys work harder. So you may want to cut down on some of those high protein foods that you're eating.
Mhm. Great.
So all of those things are really will help you stay healthy as well as keep your kidneys healthy.
Absolutely. We're getting a few more questions in here. Let me just ask you, you touched on this a little bit earlier, but what about physical activity? What role does that play, and how do you manage stress? Because obviously
Okay.
stress is, we're all under stress, but I would imagine for patients with chronic kidney disease, that can only make their circumstance worse. What do you tell your patients about physical activity, and how do they work that into a daily routine?
I tell them making physical activity a part of your routine is something that you must plan.
Hmm.
We say healthy is 30 minutes a day, but it doesn't have to be 30 minutes all at once. It could be 10 minutes and 10 minutes and 10 minutes, or 15 minutes and 15 minutes. You don't have to do it. Smaller increments may work for you, but as long as you get those 30 minutes in that one day, that's going to be better. Um, you can go walking up the stairs if you're at work, and if you're working like on the third floor and you have to go down to the first floor, take those steps down to the first floor. Don't take the elevator. We'll take the steps back up to your office. Some things that you can do. If you cannot do it at home, try working things at work. Um, I know for me, I have to. We have a parking lot, so in the summer, I just walk around the parking lot after I have my lunch break, and I walk around the parking lot at least 4 times, which I've already measured, so that I know that that's a half a mile. So
Hmm.
I think that's what we have to do. We have to look for things that are easy for us that we can work into our daily routine. We
Hmm.
also need managing stress. That's one of the ways to relax and lower your stress. Listening to music, practicing meditation or yoga, uh, and the physical activity also decreases the stress.
Hmm.
Some actually suggest that social support. So if you have a friend who has the same diagnosis or doesn't have the same diagnosis, and you can walk together or talk together, join some community groups, attend religious services, whatever is going to make you calmer, making sure that you have a good, healthy lifestyle and that you're decreasing the stress, kind of being physically healthy. The other thing is getting enough sleep. Aim for 7 to 8 hours of sleep each night. And also, you can use the hour before you go to bed as your me time,
Hmm.
and avoid bright lights and TV so that you don't have that before you go to bed. And sticking to your sleep schedule. And it may want to change your sleep schedule for the times that you work or for the times that you are at home. For those that are retired and that are home all the time, you really need to make sure that you stress making sure you sleep, and then making sure your waking hours are filled so that you don't have that much lag time in what's happening in your day. Quitting smoking. If you're smoking, quit smoking cigarettes. They can cause your kidney damage to be worse. And it also can help your blood pressure, and it's good for your kidneys, and also lowers your chance of heart attacks and stroke.
Oh, those are all excellent points, and especially on that last point. Obviously, we have to eat to live, but we certainly don't have to smoke to live. So, quitting smoking, and there are a number of resources available to help you to get off of cigarettes. Since we've been talking, we've gotten a number of additional questions related
Mhm.
to some of the topics that you've covered. One is, how can I still eat kidney healthy foods and drinks if I'm busy working all day?
Okay. One of the things I always tell patients is whatever, if you plan, you're going to have a perfect day. So I tell them on the weekend, plan your whole week's menu, cook it, put it in the refrigerator. So all you have to do is prepare it, heat it up, and prepare it. And that way you can make sure that your diet is going to be. It's not a rush thing when you get home. Oh, I got to make dinner, but you already have that dinner already planned out for each day. And I tell people to cook things like that you can use for 2 days. Like if you're going to make chicken, bake not just a portion for one day, bake chicken for 2 days so that you can have the chicken, and your size will be different. So it's not the same meal, but you have already prepared the protein portion of your meal ahead of time.
Mhm.
And then, we can have those. There's some things that frozen vegetables that you can put have less sodium and no sugar, so that you can do that. So always plan out, because of making that plan always makes you better prepared. So if we plan, we're going to be prepared, and you don't have to worry about the time factor, because you've already figured that into your daily activity. So it may only take you 15 minutes to prepare that meal, when it would take you an hour if you had not planned it beforehand.
hmm Here's this next question riffs off of something that you mentioned about being physically active. And the question goes, if your neighborhood isn't very walkable or it isn't very safe after dark, what could you do to still stay fit?
Okay, there are a lot of things that you can do right in your own home.
Mhm.
Okay, so if you're living in a home that has like 2 or 3 stories, you need to walk it and make sure that you can figure out what a mile is. And then if you need to do 2 miles, that's twice that. So if you go up from the basement to the third floor and back down, how many steps are those? So those are some things you can do. The other thing is, I know a lot of people love dancing and music. You'd be surprised how many steps you can get in if you dance. So you can put on your favorite music and dance. So if you can't, you can't go outside, so you put on your favorite music and you dance, and that is getting your exercise in, and it's toning your body as well. The other thing is, there are other exercises that you can do at home. Just sitting, when you're sitting in your chair at home, if you just kind of there's some exercises that you do that I kind of talk to my patients about. Sit in your chair, straighten up, sit down, and then just press your feet into the floor, and that gives you can feel your muscles uh, that are you're actually making sure that those muscles are getting that proper exercise.
Mhm.
Walking up the wall. If you just take your hands and you walk the wall, and you walk up and down the wall, and you have to walk up enough so that you're stretching, walk down enough so that you're squatting. Those are things that you can do. Doesn't take a lot of time, and you can do it right in your own inside, and you don't have to go outside, so you'll be safe inside your house.
Absolutely. Those are great, great, great suggestions. Here's a question from someone who's a caregiver, and it says, "Do you have any advice for caregivers if I have to take care of my parents who have CKD?"
Okay, I always tell people that the caregiver usually is not the person that's taking care of themselves. They're taking care of the other person, and they're putting that person first. The caregiver really needs to take some time for themselves. You have to make sure that, first of all, you are doing what you need to do, making sure that you have your annual physical exams. If you're on medication, that you're taking them as appropriately. If you have other kinds of health problems, that you're taking care of your own health problems as well. And then making sure that as you're taking care of the person with kidney disease, you're doing the things with them as far as diet, as far as exercise, that's going to be helpful for you as well. And making sure that you don't get stressed, get you some time away from that patient. You always need to have some time away from that patient, some respite time for yourself, so that you stay healthy, and you stay not only physically healthy, but mentally healthy.
Absolutely. Here's a somewhat related question. My parents are older, and I don't want to break quarantine. Is there something that should tell them to help them stay healthy with respect to their stay kidney healthy?
Well, I'm thinking, if your parents are actually, you cannot be with them, and they're in the quarantine situation. Is that what the question is asking?
Yes, yes.
Okay. Um, I would always tell them, actually, is that you can, if they cannot cook or prepare their food to themselves, there are community organizations that will bring them their meals, and you can always tell them actually what kind of diet that those patients are on, so they will bring the appropriate food. Or you can bring it to yourself, and if they're in quarantine, I have dropped off things for people, sit it on their porch, and then they can go out the door and pick it up. So there are some things that you can do. The important thing is to make sure that they actually have the food to eat, and making sure that it is the appropriate kinds of food that they need to eat.
hmm Absolutely. Well, we've covered a lot of very practical and important advice here. The only thing I would add is that if you do have CKD, make sure that you're up to date on your vaccinations, especially the COVID vaccine when it becomes available to you. Um, and as I said, you covered a lot of different things to adopt these more healthy living habits, but you don't have to do them all at once. You can set goals for yourself, starting with habits you know that you can be most successful on, and then build up that'll help you build up your confidence to help you tackle the ones that may be a little bit more challenging for you. Now, Dr. Hamilton, what are the key lessons that you've learned while helping people manage their health in both your role as a nurse as well as a community leader?
Well, actually, first thing I know is to speak to patients on their own level. Don't use, if your patient doesn't understand a lot of medical jargon, don't use it. Make sure they're understanding what you're telling them. Make sure that the patient really understands. I always have them repeat it back to me. How did you understand what I said? What
Hmm.
does that mean to you? How is that going to affect you? Are you able to do that? I want to make sure that if I tell them to take their blood pressure, do you know how to take your blood pressure? Do you have the blood pressure cuff at home? I want to make sure that they have the equipment and that they know how to do it. If they're diabetic, I want to know if they know how to check their blood sugar. Do you know what the numbers mean? Do you know what to do when you see the numbers? I want to make sure that they understand exactly and making sure that they understand. A lot of times, just share personal experiences if you have to let them know that it's important for them to know and to take care of themselves. It's important for them to understand what their numbers are and what their numbers mean. Just telling them that their blood pressure, you know, your blood pressure is really high today. What is the number? The patient it needs to know what the number is and what high means to that patient. It's helpful for patients to have to come with questions that they have so that you can answer them for them. I always start off on my session with, how are you today? And what questions do you have since our last visit? And how have you been feeling since our last visit? Making sure that they understand basically the routine that we set up, that they've been following it. And if they have any questions about it, or if there's for some reason they cannot follow the instructions, then we may need to change those. So it's very important for them to be a part actually of the decision making so that they can stay healthy.
Well, to recap for our viewers who may have joined us late, what are your top takeaway messages for people who are at risk or living with kidney disease to help them manage and improve their health?
Okay, I would say that there are the top three things. Is first is get tested and understand your kidney numbers. And I mean, get tested often. If you don't have kidney disease, making sure you get tested so that you can know what your kidney health is. Simple tests tell you whether you have kidney disease, so make it a priority with your doctor to have it done on an annual basis, especially if you have high blood pressure or diabetes, heart disease, or family history of kidney failure. That's very important. Testing is the easiest way to diagnose kidney problems with a simple blood and urine test. The blood test tells how well your kidneys are functioning, whether they're filtering right. The urine test checks the protein, whether you'll be able to passing that albumin out into your urine. That's really very important so that you can know that the kidneys aren't damaged. The second thing is to actually meet regularly with your patient care team, your PCP, your primary care physician, your if you have a nephrologist, meet with that nephrologist, a dietitian, a mental health provider. All of those need to be met with regularly. Staying connected and making sure that you all of them are involved in your care, and that everyone is available and engaged in taking care of what you need to do to protect your kidneys, or if you have kidney disease, to making sure that it does not worsen.
Mhm.
Um, Thirdly, I would say build healthy eating habits, healthy habits, not only for eating, but a lifestyle change. That means a regular exercise, regular sleep, rather de-stressing, healthy eating, making sure that you have the proper weight. All of those things are very important. It is absolutely essential that you keep involved in your care. because not only the medical professional can help you by giving you things to do, giving you medications, telling you what to do, it is up to the individual to make sure that they are following those and making sure they keep regular visits, making their taking their medications on time, making sure that they have the proper exercise, sleep, rest, all of the things that are very important to making sure that you're staying healthy.
Those are all great suggestions. Thank you so much for speaking with me thus far. As we continue to address more questions, and I see a few more in the box here, I just want to let you know that I'm Dr. Griffin Rogers, and I'm the director of the National Institute of Diabetes, Digestive, and Kidney Diseases at the NIH. And I'm talking with Dr. Jonnie Hamilton, who's a medical manager for Ascension Community Health and the first vice president of Chi Eta Phi Sorority Incorporated. Here's a question that just came in. It says, are there things that kidney donors should do that are different to stay healthy? Here's someone who's donated their kidney to either a loved one or someone in the community. Is there something that they should be doing specifically?
I think it's very important. Once you've donated a kidney, that means you have one left, and that you need to take care of that kidney as well as you can. All of the things that we've talked about and talked about with your blood pressure management, diabetes management, actually diet, rest, exercise, all of those things are doubly important for the kidney donor as well, because you want to make sure that you keep that kidney as well as fine, making sure that you get tested regularly, your blood tests, your urine tests, actually more frequently, and maybe you want to have yours done twice a year instead of at your annual physical exam. I think that is very, very important because you want to make sure that your kidney lasts your lifetime.
Absolutely. Here's a question that if you don't have access to advanced healthcare or doctors, what can be done to manage your kidney health?
Okay. Actually, I'm going to just say that we all really should have access to healthcare. That's one of the things that we try to make sure happens. I'm thinking here in Detroit, we have quite a few health centers that provide care for people who have like no insurance or underinsured, where they can get their medications as well. And I think there are a lot of community programs everywhere that kind of take care of people who are what we call underinsured or really have no insurance at all, so that they can stay healthy. We also need to make sure that those people are aware that they can get help. Actually, the NIDDK website has a lot of information that's helpful for people to making sure they have good kidney health. So those are kinds of things that Dr. Rogers has already talked about. It's going on that website and looking for information, actually looking for other kinds of access that they can have so that they can stay healthy.
Yeah, and thanks for that plug. I want to mention that website is niddk.nih.gov. It's the materials information is available both in English and in Spanish. It's free, covers a range of topics about kidney health that Dr. Hamilton has just talked to you about, and even more. Here we have a question, and it says, because they obviously it was clear that you think physical activity is so important, both for their physical health as well as their mental health. But what is the best, or what your favorite physical activity is for someone with chronic kidney disease?
I would say that actually walking is the best, actually two things, walking and swimming. If you can do those two things, that would be the best exercise that I would say for a patient who already has chronic kidney disease. And it actually is less strenuous on the body. And even if you just walk for like 10 minutes at a time, 3 times a day, that is going to be very, very helpful. It's going to keep you active and making sure you got that 30 minutes of physical activity. Or if you can get to a spa that has a pool, to swimming is very good exercise as well.
Absolutely. Good. Well, let's see. If we don't have any other questions, I want to thank you again, Dr. Hamilton, for joining me today for this very helpful information that you've provided to help people who are managing their kidney disease. And thank those of you who are watching us. We will post more information in the comments, and we will watch for your questions that we weren't able to answer during this live event. If you have more questions after this event ends, please comment on this video. And as I'd mentioned before, please visit our website, www.niddk.nih.gov, for more information about not only kidney disease, but diabetes, high blood pressure, and the like. I'm Dr. Griffin Rogers, and thank you again for watching.